Effective today, the nearly 12,000 GovGuam employees and their dependents are covered by the new 2011 Select Care Health Insurance Plan, and not enough money has been appropriated to pay for its cost.
Total cost is about 50 and 30 million has been budgeted, so there's a shortfall of about 20.
Budget Director Bertha Dueñas says various appropriations have already been authorized to help pay for at least part of the cost of the health insurance plan. $19.5 million approved in health insurance premium payments for GovGuam retirees, another $4.5 million to cover GovGuam's portion of the premiums for Department of Education employees, and still another $4.5 million to cover all the other line agency employees, as well as nearly $2 million more in contributions to the healthcare for UOG and GCC employees. It comes to roughly $30 million. That's what's in the 2011 budget to pay for health care for employees and retirees of GovGuam. $20 million short of what's needed to cover the estimated $50 million cost of the new plan.
It is not as an attractive business as people think it is.
Frank Campillo is the Select Care Plan Administrator, which has been under heavy criticism from the Democratic gubernatorial team of Gutierrez-Uggan and other Democratic lawmakers for premium increases that range from 90 to 287% for individual GovGuam enrollees to the plan. But despite the rate increases for both GovGuam and GovGuam employees, he says there's not much money to be made. That's why they're the only company providing it.
If the environment to do business is good and the potential for returns are great, there will be competition here.
So why are you in it?
While we're on it, well, we've been able to, in previous years, we've been able to meet some marginal expectations, and last year those expectations were not met. In this current year, we actually, our underwriter, Tokyo Marine, will end up losing money.
To be sure, on Monday of this past week, Lieutenant Governor Dr. Mike Cruz asked Select Care to disclose medical loss ratios, denial rates, and administrative costs, information Select Care declined to publicly disclose because Campillo says it is already widely available to GovGuam's negotiating team.
Like any other company, there are certain information that we consider proprietary, but at the same time, this is information that the Lieutenant Governor can be briefed on, can obtain through the negotiating team, and I believe he has been briefed on this.
I felt that given the increases that we saw, that if there was justification and it could be explained, then maybe the people would be a little bit more, would understand it a little bit better. But I just felt that we needed some better explanation on it.
On average, the increase is about 60% for the government contribution, and so that is pegged to be around 20 million that would be, needed.
Where's that money going to come from?
That's a very good question, and it's something that, the policymakers and the administration needs to get together and decide how that will be funded.
Kevin Kerrigan, PNC News.